I'm Dr. Farzad Nahai. I'm a board-certified plastic surgeon in Atlanta, Georgia, and I'm going to present some of my early experience with a product that's a little bit newer to the United States, Restylane Silk. Some of you may have already be using this and have experience with it, but we thought we'd take the opportunity today to go over some of the experience that I've had and some thoughts and basics behind Restylane Silk. I've got nothing to disclose relative to this talk. So you may have seen some of these new ads around already. I think this is the one that I pulled out of the most recent journal that I got in my office just last week. They seem to be very tastefully done, and I've been attracted to them because of this kind of idea of using art as a metaphor for what we do in our practices. This is just one of my patients, and this is just kind of our goal, to get an aesthetically pleasing appearance to the lips. And one of the reasons I showed her lips was just to go over some of the general principles behind lip aesthetics. A whole lip talk is beyond the scope of this today, but in general these are things that we're all very familiar with. We're looking for smoothness in the lip. We're looking for a nice, pretty shape, nothing that's overdone, nothing that stands out as I've had my lips injected or performed on. In general, the lower lip, at least in a Caucasian, the lower lip should be a little fuller than the upper lip. If you look at a lateral view, the upper lip should project a little bit further from the face than the lower lip does. With a smile, there should be some even amount of dental show. You can look at the presence of the vermilion border as well, the border between the white and red part of the lip. We're looking for a little bit of a roll or a little bit of plumpiness in that area. If you look at some of your patients who are in their 20s, they tend to retain that, and as they get into their later 20s and 30s, that vermilion tends to go away. We also look for this subtle shape of this Cupid's bow formation in the upper lip as well. There are countless other aesthetics also, but if you at least pay attention to those several things, you'll do a really good job of, number one, analyzing your patient's lips, and then number two, enhancing them with whatever product you choose. She has not had her lips enhanced, however, she just demonstrates some of those aesthetic components of a lip that we look for. I mentioned earlier the upper lip should project a little bit further out from the face than the lower lip, but it also, again, the lower lip is generally a little bit fuller than the upper lip. In her, you can see her filtral columns here as well. Nice Cupid's bow, nice overall shape, and they also are in balance with the rest of her face, and that's a really important aspect of lip aesthetics to consider. I'm looking at her eyes, I'm looking at her nose, I'm looking at her chin, and I'm also looking at the width of her cheeks and the width of her jaw. Her lips fall in balance with the rest of her face. So what does this have to do with Restylane Silk? Well, Restylane Silk is indicated for fine lines of the lips and fine lines of the perioral area. This is a really nice product for your patients that want a subtle lip enhancement, for patients that are looking for a modest improvement in the shape of the lips, a modest increase in the amount of poutiness or red, or improvement in those streaky lines where the lipstick tends to run. This is a really good product that falls into that category. I would not necessarily think of silk for a patient like this. This is her before, this is her after. She's looking for a significant amount of fullness. This is probably a patient who in my practice would represent the furthest amount of lip enhancement that I would do. This is probably about as large as I generally go in my patient population. So typically your silk patient is not necessarily this type of patient who's looking for significant volume enhancement. Your silk patients are the ones that want more subtle results. They're not looking to get big lips. The best patients that I've had for silk are the ones that come in 1 week, 2 weeks out from some sort of Hollywood event where all these celebrities and stars are walking in with overdone lips, and the first thing they say to me is, "Dr. Nahai, I don't want so-and-so's lips. I don't want this person's lips. They're too much." They go through the door before I enter the door. Silk is a great product for those patients that want a more subtle, natural enhancement. So really quickly, what is Restylane Silk? It's part of the Restylane family of products. It differs only in the fact that it's got a smaller particle size in the 50 to 220 micrometer range compared to Restylane, which is in the 330 to 430 range, and then Perlane, which is the larger particle in the 750 to 1000 range. It's just basically a difference of that size of holes in that sieve that the company pushes the product through so they're getting the smallest particles possible. Well, how does it compare as far as the stiffness to the other products measured in G prime? You look at Restylane and Perlane are in this 500 to 531 range. Restylane Silk is at 330, which is a little bit more than Juvederm Ultra, Voluma, and Ultra Plus. So it's kind of a mid-range in the G prime and the stiffness type of range. If you look at the studies that come from the company, as far as like how long does it last, what does it take to get, let's just dilute this down. We'll look at a treatment group that was basically treated with on average 2 cc's of Restylane Silk. On average it was about 1 cc to the upper lip and about 1 cc to the lower lip in total. Well, how long did it last? These are their results out at 24 weeks, and the Silk group still had a 69 to 70% improvement in the appearance of their lips, and this was with blinded evaluators. Same thing if you look at lip fullness. Again, looking out at a 4-week range, upper lip and lower lip fullness were improved. What about adverse events? What are the things that can happen? These are typical numbers that you see with any injectable in the face. The one thing that does stand out, and I've kind of seen this in my early experience as well, because you're injecting in a sensitive area, it's prone to swell a little bit more. You have to just prepare these patients. They have a little bit more swelling. It's a day or two worth of swelling that they can expect, but your patients who are not naive to fillers and have had other fillers before may notice a little bit more swelling with Silk in the lip compared to some other products. And that's just summarized here. All right, so what about technique? How is this filler injected? I think you can anesthetize the patient as you see fit and is typically common in your practice. I've kind of eventuated into a space where I use a lot of topical numbing creams and then ice and even a vibrating device as well in the face to help distract the patient and keep them as comfortable as I can with a product that's being injected in a very sensitive area. One of the benefits with Silk is it does have lidocaine in it as well, which tends to help. This is an injection going in the dry part of the lip, of the red part of the lip, to enhance and help smooth out some of those perioral lines. This is going through a 30-gauge needle, and this product tends to inject really smooth and very readily in this area. This is just going along the lower lip vermilion to enhance that vermilion and prevent her lipstick from running and enhancing those lines as well. This is an injection directly underneath the Cupid's bow to help enhance that part of her lip and give it a little bit more fullness as well. And then working on these small little perioral lines. I've seen and tried numerous different ways of injecting these lines. I've seen and tried micro depot injections. I've also done linear threading directly into the line itself. With this product, because it flows so well and it's purported to not have a Tyndall effect, I haven't seen it yet. I've talked to long-term users here in Canada as well. They have not seen the Tyndall effect. You can inject these lines incredibly superficially to the point where you're seeing the gray portion of the line and leaving linear threads. That's the way I like to do it. If after leaving linear threads there's still a little bit of line left, I go back with a little micro puncture technique into each of those lines. It sometimes helps me to use loops when I do this procedure as well. It keeps you incredibly precise with injecting these little fine lines. These are some case examples of my own. You saw this one in the demonstration here. She had about 1 cc total of Restylane Silk into her lip and perioral lines. This is 2 weeks later. Again, a woman who's not looking to get necessarily much more fullness to her lip, but she just wants some of these perioral lines. She is a smoker and sun exposed. She just wants these things softened up. Okay, another patient, before, after, just fuller, smoother, softer looking. Older patient, not necessarily looking for the fuller lips that some of our younger patients are, but she just wants some of these perioral lines where her lipstick runs softened. She doesn't want anybody to be able to tell that her lips have been enhanced. They have been enhanced. She can tell, I can tell. She's very happy because it doesn't look out of balance with her age group, her friends. No one really can tell, but she knows. Same thing with this patient. She's one of my most conservative patients, but wanted a little something done for her lips. Restylane Silk, 1 cc, upper lip, lower lip, perioral lines, vermilion, a little bit more show of the red part of her lip, smoothing out of these lines. And for the type of patient of mine who's incredibly conservative. She has been incredibly happy with this injection, and I can inject her very comfortably knowing that I'm going to keep her happy in how she likes to be conservative about her overall appearance. Thank you very much for your attention.